interferon is part of the possible treatment we use, but I wouldn't say it's the best treatment. Now, most of the drugs we use are tablets, and these tablets usually they are lifelong treatment, or at least they are long-term treatment. Now, the advantage interferon has is that it has a definite duration of treatment. When we give interferon, particularly pegylated interferon, it's an injection given weekly for those that require treatment. It's given weekly for a period of 1 year. And we monitor the person's response to this injection. If the response is very good, in people that have active infection, by the time they complete the treatment after 1 year, we expect that the body's immune system should be able to continuously suppress the infection, what we call immunomodulatory effect. So it's a treatment option. I wouldn't really say it is the best. There are other drawbacks of interferon when it comes to side effects, when it comes to costs. Interferon, before the dollar, naira exchange rate, let's say about 1.5 years ago, it was about 40,000 naira per injection. And now I'm sure the price may be about 80 to 100,000 per injection. I don't know the current price, but going by the exchange rate, it may be in that range. So it's very expensive, has a lot of side effects, and it's not everybody that responds to interferon. Some people finish the 1 year treatment and the viral load goes very high again, and they need to end up with the tablets. So it's a treatment option, but I wouldn't say it's the best treatment. Okay, so the next question, Assalamu alaikum, thanks for the update on the subject. The question that does hepatitis B categories on the blood group. Person with blood group B positive can get hepatitis B or others. Now, blood group has nothing to do with hepatitis B or hepatitis C or any form of hepatitis. Anybody with any blood group can get any of these viral infections. At least I am not aware of any study that has shown that maybe a particular blood group, predisposes to one hepatitis or the other. Virtually anybody with any blood group can get any of the viral hepatitis if not adequately protected against it. The next question is that I was diagnosed and did a viral, I presume that's viral load, with 575 international units. The doctor has been telling me that nothing to worry about. What can I do to eradicate it from my system? Now, when somebody has hepatitis B, it's not just enough to do viral load. There are a number of other tests, the liver function, the abdominal scan, full blood count, kidney function, a number of things. All these things are to help us to know if there are any complications and to know if the infection is active or inactive. So perhaps if all the other tests were normal and the viral load is 575, which we consider to be low, any viral load below 2,000 is considered to be low, then in such situation, you don't require treatment. But I wouldn't say that there's nothing to worry about, because in such situation, one should continue to monitor. The recommendation is that the viral load should be checked once every 6 months. The liver function should be checked every 3 months. Then the abdominal scan and what we call alpha-fetoprotein should be checked every 6 months. So it has to be a continuous checkup to be sure that it remains inactive. And when there's any sign from those tests that it's becoming active, then treatment needs to be started. And what can I do to eradicate it from the system? Unfortunately, hepatitis B, if it's hepatitis B you are talking about in this question, unfortunately, it has no cure for now. We just encourage people to live a healthy lifestyle, eat adequate balanced diet, exercise regularly, and also pray. We know that there's prayer in everything we do. Also pray. Perhaps one may be lucky that one is among the 2 to 3% per year that the body may eradicate the infection. But there's no drug currently that will say, take this drug and it's going to eradicate hepatitis B. But if it's hepatitis C, then there are drugs that can eradicate hepatitis C. And I said in the presentation, just with 8 or 12 weeks treatment, it can be eradicated. So the next question is, thank you, Doc, for the lecture. My question is, in Nigeria, getting antiviral is so expensive and scarce. Is there any health insurance that can help with this? No, well, it's part of the problem we have with viral hepatitis. Nothing about it is currently subsidized, talk less of having it free, right from the testing, the other tests one may need to do, and the antiviral drugs. And with the exchange rates, most of these antivirals are not produced in the country. They have become so expensive. Antiviral drugs that used to go for about 3,000 to 5,000. Currently, they are going for about 15,000 to 20,000. That I know for sure. And I even have patients that have told me that, see, doctor, I can't continue this treatment. Because someone told me that how much is his pension, that he was now spending 17,000 just because of one drug, and he had to just abandon the treatment. Now, over the years, we've talked to several health insurance, what we call HMOs. Those are the health maintenance organizations. They are the middlemen between the national health insurance and the hospitals. And gradually, some of them are beginning to take up coverage of some of these investigations, and some of them are also covering the treatment. So I think you should talk to your HMO to find out if they are covering, the investigations, likewise the antiviral drugs. It's something very important. I think in the new NHS drug list, I think antivirals should be part of it. Most of us don't know our rights. So when the HMO just says, no, we're not covering it, we don't bother. But if we insist and we're able to get the NHS drug list, we can make a case with our HMO to ensure that we get these antiviral drugs and even get the viral load and other tests done under our health insurance coverage. The next question is, can we get the contact of the doctor for reference and personal consultation? Okay, I think the organizers will do this. I think they may do this at the end of the program. Then kindly share centers around Kwara State where patients can see a pathologist or treatment centers. Well, I think most of the tertiary centers, well, maybe if you go to the teaching hospital, there are gastroenterologists there. So you may talk to your doctor for a referral, to see a gastroenterologist. You may have to just go there to book an appointment. I'm sure there are gastroenterologists at the University of Ilorin Teaching Hospital. So you can see people there. You can see specialists in the teaching hospital. So if some people recover 100%, then why not research and take their blood sample and isolate micro response for their recovery phase, enlighten on that as medical experts? Yes, I know there are so many studies going on. Why do some people recover? Why do others not recover? And there's not been anything conclusive to say this is why some people will recover, particularly from chronic infection, and this is why others will not recover. But we know that it's a function of the immune system. Some people's immune system may not be as strong as others. So the immune system of some people may not be able to eradicate the infection at the acute stage, and such they may progress to the chronic stage. Likewise, some people's immune system may be so strong that they're able to eradicate even the chronic infection. And some people even ask us that, what can I do to make my immune system stronger? Honestly, research-wise, we've not found anything that can make the immune system stronger to eradicate the infection. Aside probably those that require treatment with interferon, that could help the immune system. Then, thanks so much, doctor. Can one react to hepatitis C? Can one reactive to hepatitis C take vaccine to hepatitis B? What is the cause of treating hepatitis C? What medical advice for one who is struggling to raise funds for treatment? This has been my issue for years. Now, if one has hepatitis C, as I said, there are different viruses. So if somebody has hepatitis C, in as much as you are negative to hepatitis B, you can take the vaccine for hepatitis B. We even usually advise this, so that we don't want somebody that has hepatitis C developing hepatitis B in future, because we know that when those two infections are there, it may worsen the progression of the liver disease. So anybody with hepatitis C should get immunized for hepatitis B. Then what is the cost of treating hepatitis C? Currently, the cost may range from about roughly about 400,000 for a 12-week treatment. There are some drugs that are more expensive than that. And even this 400,000, it's I think it's still the lowest we can have currently. In the Western world, it may cost up to about $80,000 to $84,000. In the US, in Europe, it's far more expensive. So we have other sources of drugs from India, and other Asian countries in which the drugs are equally potent, and they cost at least cheaper than what is in the Western world. but roughly about 400,000, depending on the brand. There's some brands that are as expensive as 700,000, 1 million or more. Then advice for somebody struggling to raise funds for treatment of hepatitis C. Quite a difficult question, being that it's not routinely covered by health insurance. I think one may just need to source, for funds. Unfortunately, Nigeria health insurance coverage is not much. The government is not really doing anything much, and people just have to pay out of, pocket for, for this. There are some states in the north that have very high prevalence, like Nasarawa State, Taraba State. I think in those states, they even help the state government. They have some program in which they treat people with hepatitis C. But in Kwara State, and most of other parts of Nigeria, there's no coverage at all. Can you please drop your contact? Okay, we'll do this at the end of the program. Then good afternoon, Doc. Please, which one is called surface hepatitis? Well, it's not called surface hepatitis, it's called hepatitis B surface antigen. When we do tests for hepatitis B has different components. There's what we call the hepatitis B surface antigen. These are particles on the surface of the virus. So usually when we do hepatitis B test, what is actually checked for is that hepatitis B surface antigen. And once it is positive, being that it is found on the surface of the virus, it is, indicative that the virus is present. Next question. Thank you, sir, for your life-saving presentation. I have so many questions that time will not permit me to ask. I want to see you one-on-one. Can you please share your contact? It's urgent for the organizers. May Allah bless you all. Okay, so the organizers will do that. Then on the vaccination duration, what's your take on rapid dose, which I was told lasted for 1 month, 0, 7 days, and 21 days against the usual 6 months? Now we have different regimen for the immunization. The routine one is that you take the first dose, which we call the 0 month, then after 1 month, then after 6 months from the first dose. Then we have the rapid one, which usually it's promoted in the Western world, particularly when people want to travel to areas where hepatitis B is highly endemic. So when you want to travel in a month's time, rather than having to wait for 6 months before completing the vaccine, then we have that accelerated dosing for the vaccine, the 0, day 7, and day 21. And there's also the one that you can do the first day after 1 month, then after another month. So those are also, possible vaccination schedule. Many thanks, doctor. Then another one, thank you, doctor. Then next question is, for a child that is well vaccinated and is tested negative, is there any other vaccine to be taken later in life? Now, for hepatitis B, it is assumed that when a child completes the 3 doses in childhood, it should offer a lifelong immunity. That's what is expected. But in some situations, particularly if the child has parents that has hepatitis B or sibling that has hepatitis B, we know that they are household contacts. We usually advise that such children should get what we call booster doses. This may be given after about 5 to 10 years. They get a single shot, and that helps to boost the immunity further. So it's expected that childhood immunization should give lifelong protection, but booster doses, could be encouraged in certain circumstances. Now, once the person confirms his hepatitis B status to be positive, does it mean sex becomes prohibited for him or her to prevent spreading it? No, sex does not become prohibited. What we advise is that your sexual partner should test. Once the sexual partner is negative, the person should get the immunization. The immunization, right from the first dose, it begins to offer immunity. The second dose is to boost the immunity further. The third dose is to boost the immunity further. So we have some people that maybe they want to get married. They do their premarital screening. One partner has it, the other doesn't have. The one that does not have, we encourage the person to do the immunization as soon as possible. Sex is not prohibited from such, for such a person. It's to let your partner know, and your partner should get immunized, if negative. And of course, the person should get treated in order to reduce the viral load to prevent risk of spreading it. Okay, next question is, please, what is the role of Livolin capsule that is usually prescribed to hepatitis B surface antigen positive patient in hospital? Then is there any finding in the hepatitis B combo profile that can make someone eligible